to A-line or not the A-line? That is the question. And in the FICU, not only are we going to review the recent data, we're also going to look at a couple studies from a little bit in the past to find out how we got here. Starting with a study from 2022, this was a retrospective analysis, and they had over 16,000 patients, and they essentially said there was no difference in septic shock if you have an A-line or not. Then October 2025 came around and my boy Zhang said, no, wait a minute, I gotta look at this. And he took 6,500 patients, did a retrospective analysis, and found that, in fact, there was a 28-day mortality benefit in patients with septic shock who got an arterial line. And I just wanted to see my boy Zhang's face when Mr. Muller came out and said, actually, I have a multi-center randomized controlled trial where over 1,000 patients that says that's incorrect. And tell me why he also published it in October 2025. Girl, the T. Yes, I'm talking about the EVERDAC trial. And now this was a non-inferiority trial, which means that they're not saying blood pressure cuff is better than A-line. They're just saying it's not really that bad though. This was done in 24 centers across France. And their demographics were actually pretty equal when I looked at the table. That's something you always have to make sure of. I also wanted to know how sick are these patients, you know what I mean? And the SOFA score average in both groups was 10. So these were pretty critically ill. The majority of the patients was also septic, about 50%. There was only two things that kind of drew my attention when I was looking at it. One was the amount of blood draws that the patients that did not have an arterial line need. I'm talking, And the other thing that surprised me is that the patients who had the blood pressure cuff actually said they had more discomfort than the A-line group. Interesting. The one thing I looked for I didn't find was where the majority of these A-lines were placed. I'm assuming radial, but let's be real, we know femoral and axillary lines are more accurate. So, is this going to change your practice?